Well, good afternoon. We're fighting a ruthless enemy, an enemy that has taken so much from us, an enemy that changed our lives forever. And on a day like today, during such a significant time of year for so many people around the world, on a day when people around our province are taking a well-deserved rest, observing holiest weekend in the Christian faith, and observing Passover with families and friends. On a day like today, we can step back. We can reflect on just how much this virus has cost us, just how much things have changed, and most importantly, we must reflect on and appreciate the things that truly matter. Our loved ones, our traditions, our faith, our community, our values, and our spirit. Because it is through adversity that we grow. It's through adversity that we unite, and it's through adversity that we see what we really are truly made of. So please, during this special time of year, during these holiest of days, please call a loved one, call a friend you have fallen out of touch with, check up on a neighbor, help someone in need. My friends, we can't let this virus take what matters most. We can't let this virus change what makes us the greatest country in the world, because this terrible virus, this ruthless enemy, has taken so much from us. And before this is over, it will take even more. But if we stay united, if we stay together, if we persevere, no matter what it takes, the virus will never take what we value most. It will never take what matters most, and it will never, ever win. The virus will never, ever beat us. And we know that in this battle, there are three things that will make a difference between winning and losing. First, staying home, practicing physical distancing and slowing the spread. Second, getting the necessary protective equipment and supplies we need. And finally, a vast and robust testing regime. We have clearly seen that the jurisdictions that get these three things right are the ones that are staying ahead in this terrible fight. Earlier this week, I told you that we will do better when it comes to testing. I want to be in the positive position where every frontline health worker, every first responder, every worker and resident at long-term care homes, and everyone in the general public who needs it is getting tested. Because the first step to winning any battle is knowing your enemy. And today, we're launching the next phase of our strategy to expand testing in Ontario. We're doubling the number of tests to 8,000 per day by April the 15th and 14,000 a day by April 29th. We're going to find cases faster, intervene earlier, and stop this virus in its tracks. We will prioritize testing in our long-term care homes and retirement homes. We're going to test more hospital patients, more frontline healthcare workers. We're going to test our first responders, including our police, paramedics, and firefighters. We're going to protect those in rural, remote, northern, and Indigenous communities, and increase testing for those in homeless shelters, prisons, and group homes. We will spare no expense, not a single dime, to protect the health and safety of all Ontarians. Before I pass things over to Minister Elliott, I want to take a moment to recognize everyone who may be working this long weekend. I want to thank all of our heroes on the front line, our doctors, nurses, personal support workers, pharmacists and paramedics, our police, firefighters, and correctional officers, all the cleaning staff and support staff, thank you for keeping us safe and healthy. Thank you to the transit operators and everyone else working behind the scenes to get our frontline and essential workers where they need to go every day. I want to thank members of the media who are working all weekend to make sure the public stays informed. I want to thank everyone who is volunteering in food banks or senior centers, everyone who is dropping off food to those in need, everyone who is taking time this weekend to show they care. That's the Ontario spirit. That's what will get us through these tough times. Thank you from the bottom of my heart. And thank you for always having our backs. God bless the people of Ontario.
The next phase of our strategy to significantly expand and enhance testing is critical to our efforts to stop the spread of COVID-19. Simply put, the sooner we can identify cases, the sooner we can act, contain cases, and stop the spread. The sooner we can save more lives. To do so, we need to test more, and we need to test effectively. This is especially important for priority groups, vulnerable populations like hospital inpatients and long-term care home residents, and those at higher risk like our incredibly brave frontline healthcare workers and first responders. Nothing is more important than protecting their health and well-being. Moving forward, we are going to proactively test several priority groups, including hospital inpatients, residents of long-term care and retirement homes, healthcare workers, caregivers, and care providers, as well as paramedics and first responders, including police and firefighters, remote, isolated, rural, and Indigenous communities, other congregate living centers, including homeless shelters, prisons, and group homes, and specific vulnerable populations, including patients undergoing chemotherapy, hemodialysis, or requiring transplants, as well as pregnant persons, newborns, and cross-border workers. By zeroing in on and dramatically expanding testing for these priority groups, we can stay one step ahead of the spread of this terrible virus. A renewed and surgical focus on these groups is also in addition to the ongoing testing of the general public at any one of the approximately 100 assessment centers now established across the province. I want to be clear, anyone exhibiting symptoms of COVID-19 can and will be tested at the recommendation of their physician or a physician in an assessment center. We are able to implement this next phase because of the extensive efforts to expand lab testing capacity here in Ontario, which has helped us to quickly eliminate a backlog of nearly 11,000 people. This action has helped us to reestablish same-day testing results, many of which are now accessible using our new online portal. Our government remains committed to increasing the testing capacity in our province by leveraging hospital, community, and research labs. The further progress we make in stopping the spread of COVID-19, the more we are learning. In response to the advice we've received, we are updating the list of symptoms related to COVID-19 to include a hoarse voice, difficulty swallowing, loss of sense of smell or taste, diarrhea or nausea and vomiting. For seniors, there are additional symptoms to watch for, including chills, delirium with no other obvious reason, falls, acute functional decline, increased heart rate, and decreased blood pressure. All of these updated symptoms are in addition to the existing symptoms we have already identified, including difficulty breathing, fever, cough, muscle aches, fatigue, headache, sore throat, and runny nose. As we dramatically expand the scope and scale of testing for COVID-19, it's never been more important for all Ontarians to stay home. If you must leave your home for essential reasons, please stay at least 2 meters apart from others. This is a very critical time in our fight against COVID-19. Every step taken by the province and every effort made by each of us to avoid close contact with others are the key to our success as a province to stop the spread of this virus. We owe it to our frontline and essential workers, to our family, friends, and neighbors to restrict our travel, to act responsibly. This is the only way we are going to minimize the risk to people, contain the spread, and save lives. Nothing is more important than protecting the health and well-being of Ontarians. Thank you.
We'll go to the phone line for questions. First question.
First question comes from Travis Denrush of Global News. Please go ahead.
Hi there, Premier and Minister. We've got a report that Participation House in Markham has 10 residents and 2 staff with confirmed COVID cases. The director went there yesterday to inform the staff, and apparently all the staff left, leaving 42 completely vulnerable residents unattended. What is the province going to do to deal with the situation immediately, as these 42 residents are essentially not cared for right now?
Well, we'll make sure we get proper staff in there supporting the residents, but I'll pass this over to the Minister of Health.
Well, first, we clearly need to get staff there. The Ministry of Children, Community and Social Services and others, I'm sure, are making sure that people will be there to care for this incredibly vulnerable population. But we'll also need to make sure that they can receive testing as well, because it is a congregate setting. We need to make sure that any of them exhibiting COVID-19 symptoms are going to be properly cared for. We're going to need to put them into self-isolation and make sure that they get the care that they expect and deserve. So we need to do a number of things quite rapidly, but this is a population that we absolutely need and want to protect.
Okay, this next question is for Minister Elliott as well. What is the timeline on setting up a location for the homeless population to be treated, and what is the plan for them if they test positive? Because we know that the temporary isolation locations are saying that they're not equipped to care for them right now, and we actually have a report of somebody being put essentially back on the street that tested positive.
Well, that's absolutely the last thing that we want. We want to make sure that people who are living in shelters or homeless people are going to be cared for and get the support and care that they need. I know that the City of Toronto already has relationships with several hotels where they are sheltering people who are homeless. We are looking at the same thing provincially, because we know that people are living in these sort of congregate settings, even though they don't necessarily want to be there, but it's the only place for them to be. We're looking at congregate, other places for them to be, including hotels, motels, other places around the province. This is part of the priority group that we want to both extend testing to, but also make sure that they are able to have a place to live, which is separate and apart from many other people, because that's another way that COVID-19 spreads. So we would definitely want to make sure that they are being cared for, and that is being dealt with at our command table as we speak. We had a meeting this morning about it.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, good afternoon, Premier. Yesterday you had said that anyone who wants to be tested for COVID-19, as long as they're symptomatic, should be and can be tested for COVID-19. But today your health minister is saying that largely that decision will be put in the hands of your physician as to whether or not you should be tested for COVID-19. So I just wanted to be clear here. For somebody who feels like they have symptoms, who has the final say? Does their doctor or a public health nurse have the final say as to whether or not they get a test, or do I, as the patient, do I have the final say if I demand that I want a COVID-19 test?
Well, Colin, I want to be very clear. People have to have symptoms. We can't have a rush to the assessment centers if someone doesn't have symptoms, and if they need to be tested, they'll be tested. And I'll pass the balance of the question over to the Minister of Health.
Well, it is going to be up to the physician ultimately. If someone shows up at an assessment center, doesn't have any symptoms of COVID-19, and the physician feels that they are are not showing any of those signs, even with the expanded capacity that we have indicated today, then it will be up to them to determine. It's up to the clinical judgment of the physician that is conducting the assessments at the assessment center. There is a group of people that are called the worried well, that are worried about having COVID-19. I think almost everyone in Ontario is right now. But we need to concentrate our resources on the people that are showing the symptoms, that are the at danger to their own health and potentially a danger to their family members or other people if they are essential workers, if they have to go to work. So we need to make sure that we concentrate those resources on the people that are showing the symptoms.
Okay, and to you, Minister Elliott, in terms of contact tracing, there obviously it is obviously a very important thing to do during this time. So for patients who are undiagnosed for COVID-19 but yet are suspected cases, can you tell me what level of contact tracing is being done with those patients?
I'm going to refer this question to Dr. Williams.
Yes, thank you. And from the beginning, when we have cases who report in with risk factors such as travel or contact with a case, as well as signs or symptoms compatible with COVID-19, our public health units and their staff take those calls seriously. They interview the person, they register them as a probable case, and they have different titles for that. They treat them as if they were a case, because they know that testing, while it can be done, sometimes because of in the past limited resources, they didn't. Even now, they'll take those cases as important. They'll ask them to continue to treat themselves as a case. They'll do contact tracing with their members around them and others that have significant social contact, and they'll interview those ones as well. That's part of the process as we go forward. So just because you don't have a positive test doesn't mean we disregard your concerns and your signs and symptoms, as well as your risk exposure. All these are important to be considered, and public health will handle those in the same manner.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi there. My question is for Minister Elliott. Can you please explain what you mean by proactively testing groups? We know that there are asymptomatic people in long-term care who are still not getting tested, even if they are in homes where people have died. So why won't you test everyone in long-term care, as Quebec is doing, or at the very least test everyone where there is an outbreak?
Well, if there is an outbreak, then the situation changes, and there is clearly more extensive testing that needs to be done. The person who has contracted COVID-19, if they need to be hospitalized, of course they will be, but they will be self-isolated, and then extensive testing will then be done with respect to if they had a roommate, if they were a room with one or perhaps two other people, with the staff who were treating them, with anybody who may have come into the home as a provider of services that are essential to that home. That is a situation where we would, of course, do more extensive testing. We know that residents of long-term care homes and retirement homes, because it's mostly a senior population, are particularly susceptible to COVID-19, and that's where we want to concentrate our resources and do more extensive testing.
But Minister, to address the question, why are you not testing every person in long-term care as Quebec is doing?
Well, every province has different regimes and different ways of dealing with things. We've taken our advice from the Chief Medical Officer of Health and his team. We are concentrating resources on areas where there have been outbreaks. There are 99 long-term care homes in Ontario right now that have had a person with COVID-19, so we are concentrating the resources there. We are doing extensive testing there because this is such a vulnerable population. But as always, we take our advice from the Chief Medical Officer of Health. Not every province does everything exactly the same way. We are doing what the Chief Medical Officer of Health believes is best for Ontario right now.
Next question.
Next question comes from Faiza Amin from City News. Please go ahead.
Good afternoon, Premier and Minister. Reports from the U.S. show that African Americans are at higher risk of death from coronavirus, pointing to race and gender disparities. Is Ontario planning on collecting race-based data on how this pandemic is impacting racialized and Indigenous communities at the advice of health equity professionals?
I'll pass this over to Dr. Williams.
In Canada, we don't collect race designated cases unless there are certain risk factors and groups and areas of that level in that. Worldwide, we haven't had any further data from the WHO or from other sectors about any specific ones in particular. We will be advised by that as they come forward with various information and epidemiological evidence. Right now, we consider our main risk groups are the elderly, those with other comorbidities, regardless of what race they are, as well as other health conditions that would reduce their immune status. So those are all priorities to us, regardless of race, ethnic, or other backgrounds. They're all equally important to us.
And a follow to this, if race-based data isn't being collected, then how do we know where COVID-19 resources are needed? And doesn't that put populations at a disadvantage with not knowing what the risk factors are that put them at higher risk?
Our main concern is if there is spread, and with case contact management, we'll be able to tell which those groups are connected with. So we can do it whether it's in a geographical area, like in a location with common communal sites, or out in other aspects that where we know where the cases and contacts congregate or could be connecting. It's more important to do those points of connection rather on a blanket basis of one group or another. So you have to target those resources where the cases are with your geospatial mapping, as well as with the integrity of your case contact management.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Thank you very much for taking our questions. Premier Ford, to you. I mean, you came out the other day and you said that the level of testing right now was unacceptable and you pushed for more. Clearly, there is a plan to get to 16,000 by May 6th. But that's going to be, it's going to be staggered. You're going to go 8,000 by April 15th, 12,000 by the 22nd. Is this what you had in mind? Because it doesn't seem like it is. It's, you know, May 6th is still a number of weeks away. I mean, around a month away. I mean, are you satisfied with this new outlook?
Well, considering, I think it was April the 15th, we're doubling, increasing it by 100% in a very short period. And so increasing it by 100%, and then again increasing it by another 100%. I just want to make sure they get tested, and I'll have to check that May the 5th. I thought it was earlier on at the end of April, but we're ramping it up. We're going out there. We're doubling the testing in a very short period. You're going to see the numbers jump, and if we can do it sooner, we're going to do it sooner. But again, we're going right across a vast province and making sure we test as many people as possible. Again, 100% increase, we're at least we're going in the right direction. And I'm happy with that, and then we'll get right up to our target.
14 by the 29th and 16 by the 6th, just to be clear. Thank you, Premier.
Yeah. Okay,
and my other question, Premier, I think for you as well, is for people who are watching this and they hear this adjustment of people in those priority groups that you mentioned. For people who are watching this, explain to them what is going to be the difference, or with the new guidelines coming out yesterday. So what's the difference now? What was the difference a few days ago if you were in one of those priority groups, say a hospital care worker or in long-term care, and now? What is proactive testing from a few days ago to now? What does it actually look like? How are things changing?
Well, again, we want to make sure that we protect our frontline healthcare workers, protect our frontline healthcare givers over at long-term care and seniors, and make sure that we test our frontline responders, our first responders. And we just ramping it up and making sure that they have a peace of mind. They're on the front lines. They're facing this day in and day out. So I truly believe it's a priority to make sure that we give these folks a peace of mind. That's the least thing we can do. They've been asking for it and asking for it, and we're going to do everything we can to test as many people as possible, especially within the hospital system. The hospitals have the capabilities of testing their staff as well. So it's all hands on deck right now.
Next question.
Next question comes from Emily Pelletier from Detroit. Please go ahead.
Hi, everyone. Is there someone available to answer my question in French?
Not right now.
Okay. So in English, my question, there's now 222 deaths related to COVID-19 declared in the province. Does that mean that Ontario has surpassed the models for best case scenario for this month, which was 200 deaths and 12,500 cases?
Well, when it comes to modeling, I'm going to pass this over to Dr. Williams again.
Yes, now the numbers you're quoting there, when we look at the best case scenario that the modelers gave us last week, they are looking at the numbers again, and we're hoping to get a new forecast from them of how we're doing as we go forward. As you stated, they would anticipate that by now we would have already had close to 10 to 15,000 cases and a lot more patients in the hospital and in the intensive care units. So I think in that sense, from a quick look, it looks better than what was predicted, but we want to really give them all the data we have up till now and let them have another look at it and get back to us with how we're doing as far as the modeling and what projection we're on, as all of our jurisdictions are doing and comparing.
Right, thank you. And my next question is for the Premier. Many people would have liked to gather this weekend to celebrate Easter. I was wondering, will there be more police presence to prevent that from happening?
Well, we have the police and bylaw officers out there. But again, I've said over and over again, I just don't believe in the police state, if you want to call it that way. Vast majority of the people are listening. Vast majority of people are out there and self-isolating and social distancing. And I guess it's, I heard the mayor today of Toronto come out and say they're going to be out there all weekend, going through Monday as well. So, let's try to avoid getting a fine. Everyone knows what we need to do, and we're just asking people to make sure that they stay home with their loved ones and celebrate Passover, celebrate Easter, but do it safely.
Next question.
Next question comes from Lauren Pelly from CBC News. Please go ahead.
This will be for the Minister or Dr. Williams. We know that the numbers of healthcare workers who are testing positive keeps rising. I think it's close to 700 was the latest. We've also had the first death reported. Aside from just more testing of healthcare workers, can you talk about the latest ways you're trying to protect these people who are starting to feel more at risk amid COVID-19?
Well, we have to make sure that everyone has the PPE items that they need, and we're stocking up. As I said yesterday, the day before, I'm feeling more confident with the inventory that we have. We've had some offers from a province, Alberta. I want to give a shout out to Premier Kenny. He has a few more items than what he needs, and he's sharing it with other provinces, and we jumped in line for that as well, and the public as well. I had a call from GFL, the GFL, the big green garbage trucks that go around. They're donating today 50,000 surgical masks, and I just want to thank Pat, Paul, and Ted for donating these. I believe they told me they're going to long-term care homes, so we're very grateful. But a lot of items are coming in through companies as well. So I'm feeling much better with the supply of PPE.
And how are hospitals preparing right now for the projected peak of cases we could see in ICUs? We're hearing from physicians on the ground that they're still not sure exactly when this surge will happen, but in your estimations, do we have enough beds and staff if it comes within the next few weeks?
Well, I'm going to pass this over to either Dr. Williams or Minister Elliott.
Yes, now on the basis of the data projection, we've had a lot of the modelers in Canada and ours as well talking about in the second and third week of April, we might see that happening, so we're going to be watching for that. The hospitals have been working, and we've been working as a command table through the cancellation of elective surgery and different procedures to free up space in our hospitals and in our long-term care, in our ICUs, as well as ventilators. And so they have been preparing by getting those ready. They're preparing by practicing with their staff, making sure they have their equipment, doing the doffing and donning, as we call it. So they're going to be prepared to make sure that if and when they receive patients, and a number of them, they will do so and maintain the safety and health of their staff as well as their facility, and utilizing the equipment to the best they can. We have Ontario Health that is arranging the regional tables, meeting with many groups to look at strategies, how will you move patients around, how you distribute those coming into the various centers to make sure that one is not more overloaded than it can take. So many groups are meeting in many levels to plan strategies and do scenario matching, if you may, with the various types of worst case, moderate, and mild scenario. So they want to try to be prepared at each level. So they're all working hard, they're all getting ready, they're all preparing, and it's great to see the whole team coming together in that way.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Premier, I understand that the Prime Minister did write to you and the other premiers asking about the Emergencies Act. He spoke this morning about the conference call yesterday where he said that it was discussed and decided it wasn't needed. Can you tell us why you and the Government of Ontario don't see the Emergencies Act as something that's needed at this point?
Well, Brian, how it took place yesterday, all the premiers across the country met first, and we were on a conference call. We decided that there's no reason for the Emergency Act from the federal government. Everyone gets along extremely, extremely well. I think the Emergency Act's in place at all the provinces and territories in the country have been doing very well, and we just didn't see any reason for it. And when we got on the line with the Prime Minister, we said that there's just no reason for an Emergency Act from the federal government. So he agreed, and we're going to move forward. We're doing well. We're doing well. We're working in cooperation with the federal government, being very collaborative with each other, and along with all the premiers. You know, when again, I'm going to mention what Premier Kenney said on the phone. If anyone needs additional PPE and ventilators, he offered up, for instance, 50 ventilators to Ontario. That's like gold to us. So we're very, very grateful for his offer, and that's what provinces do. They try to help each other out. I remember, what was it, about a week ago when Premier Legault was in a tight position, and I gave him a few contacts to call and try to help him out. That's what Canada's all about, is supporting each other, and that's how we're going to get through this.
I'd like to hear from you, Premier Ford, but also from Dr. Williams on the issue of when we might see a loosening of some restrictions. Premier Ford, yesterday you mentioned the committee to look at economic measures, and today we've got polling from DART and Maru Blue showing that almost 4 million Canadians are on the verge or close to, being forced into bankruptcy if things don't turn around economically in the next 3 months. For a lot of people, that they simply won't be able to survive a shutdown that goes into the summer or into September or October. Have you started looking at planning, modeling that will allow people to get back to work while protecting the public from COVID-19?
Well, Brian, it's a good question. Our number one priority over anything is the health and safety of the residents of Ontario. As soon as we see a flattening of the curve and slowing of the spread, I'll make sure we get the proper advice from our Chief Medical Officer. That will determine when people can come back. But I hear you loud and clear, and one of the conversations that took place with the premiers yesterday was the economy, making sure that we get back on our feet. And it's staggering, 4 million people. It's heartbreaking knowing these people are just struggling right now. But I can tell you the people of Ontario, we're going to make sure we have their backs. And I know the federal government is doing the same for all citizens across the country. We want to get back. We have a great plan. I'm very confident we're going to come back stronger than ever. what I'm worried about and what other premiers are worried about, if a second wave hits us in September, because that's flu season in September, and and people have runny noses and everyone starts, surging the assessment centers, that's going to be tough hitting another wave. And we got to do everything we can, and we have to lock down the borders tight. We mentioned this to the Prime Minister, and it's by no means is it his fault, just a comment that the premiers were mentioning. Canadians are so welcoming, and that's great. They open their arms, everyone can come here, and we welcome that. But in these crises, if you look at countries over in Asia that lock down immediately, be it South Korea, be it Japan, we've seen better results. So that's concerning. That is very concerning if, God forbid, a second wave hits us in September.
Next question.
Next question comes from Sabrina Nunji from Queen's Park Today. Please go ahead.
Oh, hi, Premier. I actually just wanted to follow up on the job numbers. The March mini budget had projected, a 1 percentage point increase in Ontario's unemployment rate and 0% GDP growth. I know things are moving at an unheard of clip, but given the job numbers, are you rethinking those projections now?
Yeah, as they change, we have to look at the projections, and it was just in 1 week. Just 1 week, 400,000 Ontarians lost jobs. It's critical that we focus on making sure that we slow the spread. We want to get the economy back up and going, but we can't jeopardize getting the economy back up and going based on based on the numbers. If the numbers of COVID cases go up, we just can't chance it. And then we go away. We do 5 steps forward and 10 steps backwards if we do that. Our number one priority is making sure that we take care of the health and well-being of the people of Ontario. And there's no one more than wants to get back into the swing of things and get the economy going more than I do. But before we do that, we have to see a difference in the numbers. And if we continue, moving forward the way we are, there's light at the end of the tunnel. But this can swing any way. I wish I had the crystal ball and tell people, and are we going to be fine in 2 months? It all depends on the modeling and the information that we are able to collect, so we can be transparent and give it to the people. But the more we follow the protocols of the Chief Medical Officer, the better we're going to be.
Follow up?
Yeah, and to follow up, the House is coming back next week. You've already indicated the motion to extend the state of emergency, but can you tell us more about the new legislation that will be tabled? And at this point, are you considering moving to virtual sittings at any point?
Well, I would let Paul Calandra decide that, and he'll be organizing that. But we're going to have a minimum amount of people spread out 6 feet. And again, I'm not even too sure, to be very frank, if we can do virtual meetings, if that's allowed. But I think it's a great idea, and I will bounce it off them because it seems like everyone else can do virtual meetings. I just want to make sure that's we're able to do that.
Next question.
Next question comes from Jessica Smith from Queen's Park Briefing. Please go ahead.
Hi, thanks so much. I just wanted to clarify what members of the public who are not members of priority groups, whether they'll get tested. Minister Elliott, you said that would be at the recommendation of their physician, and the officials who briefed us at the media briefing earlier said that the physician's discretion will generally mean that people who aren't part of a priority group and don't have comorbidities but likely do have COVID-19 will still probably not get tested. Is that accurate from your point of view?
I'll pass that over to the Minister.
If people are exhibiting signs of COVID-19, even in the expanded listing that we provided today, and the physician feels if they show up in the emergency department or at an assessment center or speak to their family doctor about it and then go to the assessment center, they will be tested. They will be tested if they have the signs and symptoms, because we want to contain the spread. We want to make sure that people who are not feeling well, who are not sure whether they have COVID-19 or not, and have some of the signs and symptoms, if it's in the physician's clinical judgment that they should be tested and they're showing those signs, they will be tested.
Okay, can you just elaborate on the physician's clinical judgment? Because what the officials said was that the judgment would likely say that a person who is otherwise healthy other than COVID-19 still probably won't get tested. They'll be told to self-isolate at home. I think the public deserves a clear explanation of what to expect here.
Well, the situation won't change. If they don't need to be admitted to hospital, they will still be told to self-isolate, but I will ask Dr. Williams to come and provide a clarification of that.
So as Minister Elliott said, that people who have signs and symptoms in the wider definition have information of contact with a potential case. That's all important when they give their history to their primary care provider, be that in a practice setting or in the assessment center or in the emergency department. And then the physician, as always, whenever you ask, they will assess whether the testing in their mind is necessary at that time. Will it affect the course of care and management at that time? Because theirs is more of a clinical case carrying system, not just doing like surveys of the population. So we trust them to make that decision, decide to say, well, why don't you do this and that, self-isolate, talk with public health. But if there's something happens, A, B, or C, or D, I want you to come back, get in touch with me, contact me. We have our virtual phone system with our new codes. And if that case, then I think you need to go forward, because that will affect your care management in the future. In that sense, then physicians have the latitude. So we can't really dictate to tell them to do it. I will leave it to their expertise and the knowledge of their individual patients, who they might want to attest at what time and under what circumstances. But again, people should go forward and get assessed, at least by your primary care physician, assessment center, or ED, if you have concerns and symptoms compatible with the expanded list that Minister Elliott gave.
Last question.
The last question comes from Janice Golding of CTV News Toronto. Please go ahead.
Hi. So I have a question with regard to the Public Health Agency of Canada. They're now requesting that the RCMP do physical verification to make sure people are complying with isolation and quarantine or self-isolation requirements. Is it necessary, in your opinion, to involve the police in this way?
Well, again, I'm going to pass this over to Dr. Williams or the Minister.
Well, thank you. And when we had this announced with the Federal Quarantine Act, all of us, that means the chief medical officers of health from across Canada, were asking questions of how will this be implemented? How do we work in partnership with our federal authorities to ensure, one, that we know who these individuals are, where they're going to locate for their isolation period, and also to make sure they're connected in with our public health authorities to monitor their health during this time, and to ensure that if they need supports in order to do their isolation, it is carried out in a judicious manner. Having the involvement of peace officers, police forces, etc., I think we see this as a partnership where we're looking at the health of the community, not so much of a punitive side, but to say, we're there, we can help out on this one here. They can notify if the person has arrived back at their house or location, and make us aware too in public health if there is needs that they felt they've been communicated by those individuals. As often the officers will do, they'll notify us and say, these are things that need to be looked at. Could you check in with them and pass information and knowledge over to those individuals, saying this is part of a community safety thing. We're all in this together, and this is not meant to be a combative thing. This is much more of a teamwork, and can we help you in that? And let's move forward. And as the Premier said, we're all pulling on this together.
Okay, and another question. You've talked about proactive testing. that you want to protect our healthcare workers, and so that you're going to be testing them and ramping it up to give them peace of mind. But what will this consist of? Does this mean that you are going to be testing them on a daily basis? Because as we heard in the technical briefing, someone could be negative today, but they will be positive tomorrow or the day after because of their exposure. So what is this proactive testing of healthcare and frontline workers going to consist of?
So the proactive testing of all those individuals you noted is if and when they're into a situation where they have been in an exposure situation and they want to ascertain in a timely fashion, and we leave that up to a combination of the individual and their occupational health and safety officers to carry that out. And so there's two things you want to make sure you're going to deal with. One, has there been any, has the worker been put at risk due to some breach in infection prevention control practices? If so, how are you going to monitor that person in that time? When you put that person to isolation, you want to make sure you do it in a rapid process so that the rest of their teammates around them, the platoon or whatever, is not compromised at that stage. And the more important one, as far as these very valuable and frontline staff, is after you're convinced in a period of time that they're okay to return, you want to ascertain by testing, even if they're not symptomatic, are they negative, especially if you're going into a healthcare setting where you're dealing with highly compromised individuals, or if you're a frontline worker going back to join your team, you will not compromise and put your teammates at risk and then have even more people off for a longer period of time. So proactive means we're taking the direction from the occupational health and safety, working with them to ensure the health of that individual worker as well as their whole workforce and of the institution that they're involved with.
Thank you.
That's great. Thank you, everyone.